The German poet Goethe once wrote, "What is most difficult? That which you think is easiest, to see what is before your eyes." I think of this often because one way of looking at the last 50, 60 years is this dramatic shift in awareness and consciousness about adverse experiences for children.
Adverse childhood experiences, really trauma, can be many things. Obviously, violence, abuse, neglect, physical abuse, sexual abuse, and violence either witnessed or experienced. And what's been established over the last 20, 25 years is this unescapable link between childhood trauma and adult health. And so this conference is to call that issue and to continue to create a collective impact and transformation in how we look at health and healthcare.
When I was a young physician, the things that killed people were infectious diseases. That's what killed children, it's what killed adolescents, and certainly adults, and it's not today. The kind of science, remember that as a medical school student, I reified, is now saying, you gotta consider context because it affects you biologically as well as sociologically and psychologically. There's been a major push at the World Health Organization and nationally of saying, you know what? Adversity in childhood kills you as an adult.
Pediatricians may have the only place where parents and children are sitting together, focused on the child's health, with a third party that can help them or has access to the system. I don't know where else that happens. I remember writing an article for our local magazine about 15 years ago, and they said to me, "Dr. Hassink, what do you think the major problem in childhood is?" And I was doing obesity, and I said stress, because that was what I was experiencing every day in clinic when they were telling me their stories. We now are needing to address the underpinnings and the foundational issues of child health. We're now challenging ourselves to really start asking those questions. How are you? What is happening? What is your context?
I've been in the insurance business 35 years, and much of that has been with adverse populations in the Medicaid area. We have about 3% of our folks that spend 29% of the dollars and 12% that spend 60%. And so in our case, that's $500 million. When we actually go into the data and begin working with the patients that are spending a lot of money, what we find is there is a medical history of long-term toxic trauma.
Care delivery to children is, I think, going to change a lot in the next 10, 15 years. One of the dominant conversations in national policy and also at the state level is the cost of healthcare. And that pretty much clouds every other priority. I think it's very important for the research to be able to also examine what contribution to costs, untreated, unprevented, unmanaged adverse experiences has on the healthcare system.
2/3 of suicide attempts in adulthood are attributable to the accumulation of adverse childhood experiences. 2/3. The anger that victims often feel at being denied legitimacy for their experience is an important part of this.
We're beginning to see a shift in thinking about how do we take this knowledge and understanding and bring it into clinical practice.
Insurance companies are open to this, and they can create coalitions and influence policy in powerful ways.
The exciting thing right now is that there is a growing network of individuals and programs and experts around the country who have come together to help each other make an impact on this challenge. I really think this is the right time. This is that window of opportunity for us to try to make a difference.